Hello, everybody, and thank you so much for joining us today. My name is Joshua Smith. I'm the Senior Director of Carrier Relations here at ConnectureDRX. Today, we're going to be reviewing the benefits of working with one of our value based care partners. It's my pleasure to introduce you to Franklin Morgan, representing ChenMed and Dedicated Medical Centers. Hey, Franklin, thanks so much for being here today. How are you?
Hey Josh, thanks so much for having me. I'm doing great. How about yourself?
Doing fine. Thanks for coming onto the webinar. Really enjoying, or excuse me, can't wait to hear what you've got for us today. So feel free, take it away. Tell us about ChenMed and the family of partners.
Awesome. Well, thank you so much for the info or for the intro, and thank you so much everyone for joining. I'm really excited for the opportunity to provide you all with an overview of ChenMed. As Josh mentioned, we are a value-based primary care provider dedicated to serving seniors. So I just want to start with a few of the metrics that demonstrate the level of service and dedication we provide to our patients. Compared to the national average, seniors at ChenMed experience 35% fewer emergency room visits and 51% fewer hospitalizations. We are truly committed to providing quality care that keeps patients out of the hospital and better able to enjoy their lives. This last metric on the right highlights our biggest differentiator compared with non-value-based care providers. Our primary care providers see 80% fewer patients than the typical primary care provider. This means we have so much more time to spend with patients to really understand their health needs, understand their health goals, and set them up for success. So with that in mind, I'd love to take the next few minutes to give you an overview of who ChenMed is and the value we offer to both you and the individuals we serve. So as mentioned, we're ChenMed. We honor Medicare eligible seniors by providing affordable VIP care that detects and prevents high-risk diseases and simplifies complex care. I'll go into that last sentence a little bit more in a couple of slides. But one other thing I want to call out here is we do have three distinct brands. They all roll up under the ChenMed family, and they all operate in the exact same way. They're just in different markets. So the three brands are Dedicated Senior Medical Center, GenCare Senior Medical Center, and Chen Senior Medical Center. On this next slide, you can see where we're located. We have 111 centers in 12 states. The numbers that you see on this map are the number of centers we have in each market, and the color corresponds to the brand name that we use in that location. So if you're in South Florida, you should see Chen Senior Medical Center, whereas if you're in Houston, you'll see that Dedicated Senior Medical Center brand. So would love to take a minute to dive into just exactly how our model is different and so beneficial to the seniors that we serve. The first point is we prioritize whole person care. We invest in our patients day one, running a complete health assessment to develop a comprehensive personalized care plan. This is huge because before the patient ever sees their primary care provider, we've done a full set of tests, screenings, received medical records from previous doctors, and it gives our primary care providers the opportunity to just take time to get to know the patient, talk to them about what their goals are, what their needs are, rather than needing to run a series of tests and just gather information. The second point is we make care convenient. We offer 24/7 access to care and conduct laboratory services and screenings on site. We also dispense more than 400 medications conveniently on site. Our goal is really to be a central location where patients know they can come to get the care they need, in addition to other resources outside of primary care. And I'll talk about those in a second. The third is our focus on primary prevention. We see patients as often as necessary to optimize their health, which is typically once a month. We offer same-day appointments, walk-in, and virtual care visits. So rather than just coming to the doctor when you're not feeling well and things are already going a bit wrong, we are really focused on developing a care plan with our patients that keeps them healthy so that they don't have to go to the ER and they don't have to go to the hospital unexpectedly. So the goal is really to establish relationships with our patients where they feel like they can come to us for anything, any questions that they have, anything that's going wrong, and we can address it before it starts to go really far south. And finally, we simplify complex care. The US healthcare system is very complicated and can be very confusing to navigate. We collaborate with a vast network of trusted specialists and hospitals to coordinate complex and specialty care when needed. So If a patient needs something outside of the scope of our services, we do everything we can to get them scheduled with a specialist, get them connected with a hospital, whatever they need to receive the care that's needed at the time. We can make sure that not only are they receiving that care, but we're helping to coordinate it and making sure that any results that come from that are brought back into our primary care care plans. All right, so I did just want to highlight a few of the services that we offer in addition to primary care. So many of the services that we offer at our centers include additional specialists such as cardiologists, acupuncturists. We have podiatrists and social workers at many of our centers. Also have, as I mentioned previously, medication rooms on site. So patients can get the medication they need without having to go to a third-party location. Similarly, we have labs and testing on site. You don't need to go to a separate appointment to get your labs done. You can get it done as you're visiting with your doctor. We also offer x-rays, transportation coordination to and from our appointments. And many of our centers have a wellness room that allows us to host exercise, educational, and social events. So really are offering more than just that doctor's visit that you go to once a year. The goal is for this to be almost a community center where you can receive education, interact with other seniors in your community, and get the answers you need to any health questions that you have. So again, would just love to highlight some more of our metrics. We take our work really seriously. We're very dedicated to serving the seniors in the communities in which we operate, and we want to make sure that their experience is a positive one. So we're very proud of the fact that we have unmatched patient satisfaction. 96% of our patients were able to get an appointment to see their physician right away. 92% of our patients were satisfied with the amount of time their physician spent with them. 96% felt our staff treated them with courtesy and respect, and 95% say their doctor listens carefully to them. This is really the core of what we're trying to achieve when patients feel like they have a place to go and be heard and get their questions answered. They can feel more empowered in their health and stay healthier over time rather than having an issue and needing to go to the emergency room or needing to go to the hospital. So we're really, really proud of these metrics. We track them really closely because we want to make sure that we are delivering on that VIP care that we promise. So I did just want to highlight a couple of ways that we can serve you as an FMO or a broker. We partner very closely with FMOs and brokers in our communities and also through amazing partners like Connecture. So a few of the ways that we can support you, we have membership growth consultants who guide patients internally through the process. They can help set up appointments, answer questions, and offer quality customer service to your clients. We also take loyalty and respect for your clients and you very, very seriously. We never initiate changes to an existing Medicare Advantage plan, and we always refer benefit questions back to you. And finally, on a similar note, we take various steps to protect the agent of record for any patient that comes into our center. So we track agent of record through Salesforce, and our staff are trained on the importance of reaching out to the agent of record if that patient expresses any interest in learning more about different plans or has questions on their plans or any issues that they'd like to bring up. Just a few other things. Again, if you operate in any of the markets that we're located in, we would love to connect with you. A few of the things that we can do together on the ground are we can make introductions and connections to community contacts to engage in the neighborhoods in which we serve. We can co-host educational events on site at our centers in those wellness rooms that I mentioned. We also have access to marketing resources that can help promote your services and opportunities to co-brand and market, marketing materials and different events. So I went through a ton of information. Again, really appreciate the opportunity to share with you. I would like to call out, if you have any additional questions, I'd love to connect you with my colleague, Mike Sapusik. He's the National Director of Organic Growth, and his information is right here. So please reach out if you're interested in learning more or if you're interested in connecting with us. And again, thank you so much for the time. I'll pass it back to Josh.
Awesome. Thank you so much for the overview, Franklin. Like in addition to the obvious awesome patient relationships that ChenMed has with the members, I really love the partnership that your team has with the insurance agents and agencies out there. I really think that it bridges the gap between the client, their plan, and their provider to make sure that the client is served best from all angles. And for that, and for everyone that's tuned in, that's all we have for you today. So thanks again for your time. Thank you, Franklin, for your time as well. If you're watching and you have any questions, please feel free to reach out directly to us or to your customer success team for an introduction. We look forward to bringing you more information on ChenMed and our other partners real soon. Thanks again. Take care and goodbye.